there's nothing better than the Futures program. The Futures program was why I discovered AMDA, and I never looked back. So I came to the Futures program, and Cheryl Phillips was the lecturer that day, and I thought, this is wonderful, and I need to meet more people like her who are inspired by this environment of care, and have been very inspired by many others in AMDA.
I'm hoping to just learn as much as I can and learn from other providers who have been doing it for a long time, since this is new to me. I'd love to learn tips for, seeing patients more efficiently, dealing with specific patients, dementia patients, patients that I don't have a lot of experience with. It's new to me in this for this practice. I'm looking forward to some of the lectures about managing medications and cutting back, helping patients cut back who come in and are admitted with so many medications that are unnecessary.
I'm probably most looking forward to some of the education sessions that they have that I thought are very interesting and geared towards medicine. Some of the other parts, though, are with a lot of people that are just getting into it, as I am, getting to meet them and network.
He said, "Have you heard of the Futures program in AMDA?" I said, "I have not. What is this? This sounds like it could be right up my alley." So the following year, when I was a fellow, I requested to go to the Futures program in AMDA, and my program supported me to go. Loved the Futures program, and then just slowly became more and more involved with the organization.
Really interesting and a nice way to sort of meet people, break into small groups. The reception was great. It was really good food. There was good food and drinks, and it was a good way. I definitely networked and talked to a lot of different people. It was a good smaller group. It was definitely a good way to start the program off with just the Futures program in a smaller room, and talk to a lot of people in just a few hours.
So I think the Futures programs is really the place where fellows have an opportunity to learn that long-term care, post-acute care is an exciting and interesting place to practice. Many fellowships do not have a lot of exposure to the long-term care environment.
I recommend the Futures program to anybody who may not know a lot about long-term care, may not know a lot about medical direction, who may be starting a career or thinking about starting a career in this setting.
Today was really broken down great. It looks like a long day, 7 to 5, but the way it was broken up with lectures and small groups and panel discussion, it was a really great, really educational day, and it held my interest all day. I was never bored. Everything was really interesting and educational. I really liked the lecture about falls and fall prevention. I thought that was really helpful, since we've had some falls recently with some of my patients at the facility. And then I liked breaking up into the small groups at the beginning and talking. There was only about 8 people in my group with one of the medical directors, and getting to ask questions one-on-one like that was really educational. And then I liked the group panel and getting opinions from 5 different people who have been doing it a long time. That was really helpful as well.
It's perfect for fellows. It's good for anybody who really is making some kind of career move or career change into the practice of long-term care and medical direction.
I would definitely recommend it to nurses who are looking. I have a lot of friends who are nurses who are looking for a new field or don't really like working in the hospital, and I've been saying, you guys should look at working at our new long-term care facility. And I think to open their eyes to that, like the physician I work with is in emergency medicine, so physicians who, internists or who might have an interest in that, this would be a really educational program and kind of open their eyes. I think a lot of people don't know all that you can do in long-term facilities.
What I teach to the fellows and to the fellow Futures and to the fellows in our institution is, if you like internal medicine, you will love geriatrics, and you will be enthralled with post-acute and long-term care.